Thanks for joining us. We are here with Real Talk with Teri. I'm Teri Furman, and we're talking about our aging parents and how to take care of them. And we are fortunate to have an expert with us today. We've got Dr. Jonathan Singer with the Garrison Institute on Aging with us today. And Dr. Singer, you've been doing this for a while, and we've kind of chatted a little bit about this. You know, we take for granted that when we're growing up, our parents take care of us and they take care of everything for us. But you don't realize, okay, wait a minute, my parents are also going to be aging at some point. And you get to that point and you don't realize it until you're there. Yeah. So what are some of the signs, symptoms, things that people see when their parents start aging? What do you start noticing?
Well, thank you first for having me. It's an honor to be here, and love talking about this because it's such an important topic. And so there are many signs that we can look for when we are aging or when our parents are aging. And I think you hit it on the head where we might not know it's coming. We might not see it. We might feel like everything's going really well, and then it hits us. But then you slowly start to notice these different things. And as we age, there are things that we might not be able to remember that word. Or we might walk into a room and say, oh, what was I doing here? That's normal aging. And we don't want to pathologize that in any way. But when it starts to become excessive, when it starts to become, I say, bigger and affect functioning, then I start to worry a little bit. And I always want people to check in. So that could look like something like, I've been coming home, going to the same grocery and coming home, my mom has for the last 30 years. Okay. And she calls you and she's like, I don't know how to get home. That would be an indication I would get her in as soon as I can to get her worked up. And it's so important that we notice these signs and that we are a little bit more conservative. So if you have the inclination that something's going on, I say follow that gut instinct and get them in. The worst thing, and my favorite thing to say to people is, this is normal aging. And that's great to give that diagnosis, so to speak, or lack of diagnosis for better.
And so it being normal, you know, cooking for themselves, you know, maybe, you know, not remembering, you know, how to work things. For an example, I had to help my mom with her washing machine. She got a really smart one, and it's washer and dryer together, but she was like, it just doesn't work. And so she was like driving, you know, 40 miles away to go do her laundry, you know, a couple times a week. I'm like, it can't be that hard. And so all I did was like Google it, and it told me how to fix it, and it was super quick. And she was like, oh my gosh, you fixed it. And I was like, I wish that, you know, I would have known how to do that, but she's not as technologically advanced.
Yeah, and there are things that happen where people might not know to Google, or there might be gaps as far as our education compared to our parents. Where it gets kind of worrisome is if she's starting to make maybe some poor judgments. So let's say there's a laundromat down the road and she's driving an hour, like you said, or, you know, scams are so problematic right now and scary. But if it's multiple times they're getting scammed, you know, those are the things I'm looking for. Okay. Those making decisions that you just kind of scratch your head. And now if one happens, okay, I'm not too worried. But if multiple are happening over and over and over, I'd get them in. So going back to your mom, like, you know, technology's challenging. My parents have trouble. They call me all the time to fix this or fix that, or there's this window that popped up. What do I do? That I wouldn't be too worried about. But if they're making poor judgments around it or getting scammed a lot, I definitely would get them in to see somebody.
Okay. And, you know, there's resources, you know, in all places. You said that, you know, and it's not just the Garrison Institute on Aging. We've got a lot of resources available to us, especially in Lubbock, as large as we are and as fast as we're growing. What are some of the things, you know, you talk about, okay, so it might happen here or there, but when do you start becoming concerned about safety, your parents' safety?
Yeah, so when you're seeing burners, you know, left on, when you feel like a big thing we look at about living alone is, can they call 911 on their own? And I even test people, like, ask your parent, like, call 911 or call me. And if they lose that ability to do that, that's where I start getting worried about safety concerns. And that's where I might be thinking, you know, it might be time to maybe get more help in the home. And there's a lot of people here, a lot of different agencies agencies that will help with in-home care, because one of my missions and things that I try to do is keep you in the home as long as you can safely.
Okay. Right.
That is so important. So I just wanted to reiterate that. And then kind of going back just for a second, if you don't mind,
No.
because I want the listeners to really know that early identification of these symptoms and disease is so important. We have a medication out now that slows progression. It doesn't cure Alzheimer's, but it slows it. And what the new data that just came out that was presented last month is showing us is that the earlier we detect and put somebody on the drug, the slower the progression. So earlier, I tell people. And, the worst thing you can do, like I said, come in, you're perfectly normal, and now we have a baseline of where you are or where your parent is. So I just wanted to go through that. And one of the things I'll talk about is through many of these clinics in town, and our memory clinic at the Garrison Institute on Aging, we do safety eval. So we'll kind of look at different things like ADLs, IDLs. Should you be driving? Should there be guns in the home, or should they be locked up? These are all things that are not just about safety of the person, but safety of others around. So those are really important things that we have to consider and we have to plan for.
Okay. We visited about it a little bit while we were talking before the podcast. When it comes to safety, knowing when it's time to have someone come into the home for their safety, to check on them, to make sure their meds are okay, that kind of stuff. Where do you begin to start to look for things like that?
Yeah, so I say even when you're diagnosed, even with it's something called mild cognitive impairment, if we're at the very beginning, I would start planning. And sitting down as a family, and we do family meetings at the Garrison Institute on Aging where we really try to say, okay, when is it time for you where you feel like you need to take over medication, where you need to take over finances? And we help facilitate that conversation because it can look different for different people. And the other thing is I was just with a patient earlier and they said, how am I going to progress? How's the next 5 years? It's hard to know. So why not plan today? And then in the future, it makes life so much easier. So I think planning early, even if you don't have the diagnosis, thinking about things like when do you think you might need help? Or if they can't bathe themselves, when should we get home health to come in? Or maybe even feelings of isolation we know are such a risk factor. Maybe bringing in respite. Home Instead works with us a lot. Getting them in the home to help go to appointments with me. We have one person who their loved ones are all over the U.S. and so they have Home Instead, someone from Home Instead go to their appointments. How cool is that to have somebody there that you can trust if you're a long-distance caregiver, which is not talked about enough?
Well, and of course, we're just beginning the baby boomers, this generation, to where they're aging. There's a lot of them aging at the same time. And a lot of people, depending on, when they chose to have their kids or when, we were born or whatever, we're still raising families. So what are we looking at as far as balance?
Yeah, we call this the sandwich generation, and it's only going to increase the number of people that are in the sandwich generation. So this is that pull between I got to be a good mom or dad to my kid, but then I also need to care for my mom or dad who needs me for these things, and also have to work 40 hours a week on top of it. And so trying to engage and to find those resources in Lubbock, I think, can only help. And we have tried at the Garrison to really try to facilitate ways that, a lot of times you get the diagnosis and there's not a lot we can do. But what are the resources we can provide? We have a program called the GUIDE program. That's a nationwide program I'm happy to talk about. But to provide resources that are low to no cost and that can help keep the person in the home longer and can help the family member who has a child who's maybe having a difficult time right now, but also their parent. And now I'm grieving my parent who's going through this process that we, might not know a lot about dementia,
Right.
but then also my kid is growing, developing, going through all the challenges there. So it is so challenging for any individual, but especially that sandwich generation, and you can even feel guilty almost on either side. Oh,
on
I'm
either side.
with my mom, so I'm not with my kid, or I'm with my kid, so I'm not with my mom.
Right.
So dealing with those emotions.
Okay, Dr. Singer, we're going to take a quick break real quick, and we will be right back with more Real Talk with Teri talking about that sandwich generation. Welcome back to Real Talk with Teri. We are joined today by our expert, Dr. Jonathan Singer with the Garrison Institute on Aging, and we're talking about the sandwich generation, because we're still raising kids, but at the same time, we've got our parents that are also aging and trying to figure out what is best for them, what is best to do. So you were talking about the GUIDE program a little bit ago, and first, I want to go back to the sandwich generation and talk about kind of the stress that kind of comes in on that, on the caregiver that's not only raising kids, but also trying to help your family.
Yeah, this is something that, I've been doing a lot of research in this area for many years, and we focus on stress and burden, and there's a lot of research on that, but there's also the emotional toll of what we call pre-death grief, and trying to deal with that on top of it of, yearning or longing for that person before they were diagnosed with dementia. And also we see that individuals with kind of early stage dementia can even be grieving their own eventual death. Right. And how do they manage that? So all these things build up, all of the stress, the burden, pre-death grief. And what we know is from the literature now is that family members who are caring for a loved one with dementia now, that is a risk factor for dementia as well. So we have to be careful. We have to care about the caregivers. And that's why a lot of the interventions around the country and around the world are coming out are called dyadic interventions, trying to help the whole family. We have to create resources, and we have to create interventions for the whole family, because right now, I think it's somewhere in the $30 billion that caregivers, unpaid caregivers, are saving the country. Yeah. I mean, think about that and how it's only going to increase. And what we know is that where it's going to increase is not 65, 70-year-olds. It's actually 80, 85-year-old, which then the family caregiver is probably older as well.
Right.
So we need to be thinking about this as a family disease.
For sure. And some of the ways you talked about this GUIDE program that is in a lot of different places. So some of us that have the parents, and it's something about the 5-year mark, I'm just going to wait 5 more years. Just let me stay in my house 5 more years. And then you go by 5 years. Well, it's been 5 years now, but no, just give me 5 more years.
Yeah. So the GUIDE program is a CMS program through Medicare, and it's offered all over the country. It's not just here in Lubbock, and we just started in July here. But what it is it's my favorite part of the whole program. It's completely free. There's no copay. There's nothing. And it's really what Medicare is trying to do is trying to keep people in their house as long as possible and not in a memory care unit or a skilled nursing unit. And what they've done is have these 9 pillars, they're called. And there's things like medication management, care navigation, referral management, all these things that help the caregiver education, all these things that help the caregiver and the person with dementia stay in their home longer. But also they have $2,500 worth of respite for free. So that means somebody coming in the home, and we're partnering, so we're a GUIDE site, it's called, and we're partnering with Home Instead to provide that here in Amarillo. Wow. So that is anybody diagnosed with dementia, and they have to have Medicare A and B. So that's really important that we get these resources. Now, outside of GUIDE, there's so many resources here in Lubbock. And one of the things that makes me proud is a lot of times people are going to Dallas or to Albuquerque, or people are now coming to Lubbock from Dallas and Albuquerque. We're seeing at our memory clinic. And that's so neat that we have the resources here. We have to get the word out. And that starts with you, Teri, getting the word out to people, and knowing that these resources are there for them, and making sure that they're affordable. We know this disease is very expensive. People think about it and say, $40 is not a lot for a copay. Well, $40 times 7 every month, on Social Security or on a retirement.
on a
That's
fixed income.
On a fixed income. That's a ton of money.
That is.
And then when we get into the rural areas, we see people who are really will say to me, I say, how come you haven't got screened? And they'll say things like, well, it was keeping my lights on or going to my physical.
Right.
And we don't think about things. We need to think about things
We
like
have
that.
to.
And we have to be able to help everybody. So that's what we're really trying to do at the Garrison Memory Clinic.
And a lot of this, Dr. Singer, I think starts with doctor's appointments, going
Yes.
to their general practitioner. And that can be challenging because if they're not in the same place that you are.
Yes,
I mean,
absolutely. That is so
I struggle
difficult,
with
yeah.
this. My mother is not in the same place that I am. And so you're finding a relationship with the doctor. And whether you go or you don't go, you can still make phone calls to that doctor and say, here's what's
Yeah.
going on. I need this to be addressed.
100%. And it starts with what we call advanced care planning, which we work on, and making sure that families have what we call power of attorney over health and other things, finances or whatnot. Because having access to that doctor, or even asking the provider, calling the office, hey, could you Zoom me in? Now we have this amazing technology. We at our clinic will Zoom people in. We'll have 3-4 family members connect through Zoom.
Great.
Because it's like, things get lost in translation,
They
right?
do.
And it's a highly stressful. We're giving a diagnosis that carries a lot of baggage with it, and so we want the whole family there. We want everybody to be part of this process. So I would recommend, if you're a long distance caregiver, or if you're a caregiver that, or not even caregiver, but you're worried about your parents, and they're going to see their primary care physician, say, hey, can I jump on a call with them, or can I Zoom in with this appointment? I always say we try to empower family members, be that person that can help your loved one through this. So absolutely. And even asking for a primary care physician to give them a screener. Just see where they are, get a baseline. That helps us when we go to diagnose. If they have something like a MOCA, which is a screener, or MMSC that was a year and a half ago, it kind of gives us an idea of what's going on in a baseline. So absolutely, I recommend just asking for that.
Okay. I didn't think about the Zoom call. That's not something I thought about. I had a great relationship with the former GP to where I could call and say, I know she's coming in soon.
Right.
I'm concerned about this, this, and this, A, B, and C. And he would, facilitate that. And then Mom would tell me about the appointment. Yes, he understood your concerns. Here's what we talked about. And that's great. But Zooming is even better. That's a good idea.
Absolutely.
Something else, when it comes to finally deciding to move them out of the house, a lot of people, we don't want to just put our parents in a nursing home if they're still able to get around. But at the same time, we want them to be safe.
Absolutely.
So what are some of the things that we need to look for when choosing whether to bring them home with us, the stress level of that, and putting them in a facility or maybe even a smaller place to stay?
Yeah. This is probably one of the hardest decisions that we help caregivers with. And we don't make the decision for them, but we help facilitate an understanding of, really, we start at safety. Okay. Are they safe at home? And then after safety, we want people to stay at home, like I said. What are the resources out there? What can we do to keep them safe at home? And if those are adequate, then that's great. Now, if we get to a point where they're not adequate, or that we have home health and we have respite or other things, and it's still a safety concern and we're still worried, that's where you have to have the difficult situation of having to place them. And that's hard. A lot of caregivers are guilty. A lot of adult caregivers in these sandwich generation caregivers are saying things like, I feel guilty. They took care of me my whole life. They've picked me up when I've been down. Why can't I be there for them? And I always turn that and I say, we need to make sure that we are doing the best thing for them. And so we need to make sure that we do that.
All right. We're going to take another quick break real quick. Dr. Singer and I will be right back with Real Talk with Teri. Welcome back to Real Talk with Teri. We've got Dr. Jonathan Singer with us from the Garrison Institute on Aging, and we are talking about when to be concerned, when to move parents out of the home or find something else to do. And we're going to kind of wrap up with a lot of resources that we can rely on and start with, and also talking about power of attorney. So, Dr. Singer, we want to visit about those things. Yeah. So we kind of, ended abruptly on, when to make certain moves, but you've got to have power of attorney to make certain moves.
Yeah, and one of the things that we built the memory clinic that opened at the Garrison Institute on Aging about 10 months ago now we started, and one of our missions was exactly this: have advanced care planning. We have to be discussing it. A lot of people don't even have a living will, and starting there. So I always start with people, do you have a living will? And making sure that difficult conversation is done when everybody in the room can understand what's going on, hear the wishes of the person, and then getting them written down, notarized, or a lawyer looked over them. This is important. And then the second thing I always say, that's never too early to get power of attorney over health, over finances, and making sure that all of the person's doctors have that information, because there might be a time where that person can no longer call, make an appointment, get the records for a neurologist or for someone else, and it's important that you have the ability to do that without them signing a release. So having power of attorney is so important. And then the other thing that people don't talk about enough is power of attorney over finances. Yeah. And this is really important, and some people say, well, they're on my account. And honestly, every bank has different things that have different requirements of how much. They have restrictions. If you're a secondary, you might only be able to pull $5,000 a month or a certain amount. Right. We had a caregiver recently who was going to place their loved one and couldn't access all of their money because of that, and they had to put a down payment, and it prolonged things a little bit. Right. And we never want to see it get into the courts. We never want to see the state involved to that. It's already a difficult enough time. Right. So I always say, take your power of attorney in finance, give it to all the banks, and make sure and get it in writing that they're okay with it. Some banks even have their own power of attorney forms that you can fill out as well to make sure. And that's because of the scams and other things. Right. So having it over health, having it over power of attorney over finances is so important. And then the last thing we always discuss is, hospice over the last probably 10 years has changed a lot of their requirements and different things. And I tell people, utilize hospice services. It's not, a person's going to die in a month. Right. People are in hospice now for years, 2-3 years. So I say, get an evaluation. You can get evaluated as much as you want, pretty much, and it doesn't hurt to get evaluated. So I say it brings resources, and it could keep people in the home longer if you have hospice. So knowing your resources, knowing when to utilize them, and making sure that you reach out and not, I always tell people, don't feel guilty. And I kind of turn it on my caregivers a little bit, because they say I'm selfish. I was talking about that a little bit more. I'm selfish because, I'm placing them in a home, or I'm not bringing in respite. And I actually say to them, you're actually selfish for not doing it, because we know that if you're feeling better, if you have less stress, you're a better caregiver to them. True. So I always turn it on my caregivers and say, you're actually being selfish for not asking for help and utilizing the help that's here. And in Lubbock, we have wonderful people here that are here to offer that help.
I love that. Let's talk about some of the resources that people can use here in town, or even our outlying rural areas that Lubbock can go to and help with that. So let's talk about some of those.
Yeah, we have a ton of resources. We're very lucky now that Grace Clinic is offering lecanemab, which is the new medication for Alzheimer's. It slows the progression. So we send a lot of our patients there to Grace Clinic, and they have some wonderful doctors over there. Like I mentioned before a little bit, our memory care clinics. So I'm a clinical psychologist, so we do neuropsych testing with you. We have a geriatric psychiatrist, Dr. Urs, who is just wonderful. I've honestly never seen a provider that cares so much about her patients. She spends about an hour to an hour and a half with patients. Wow. It's really unbelievable. She's brilliant with medication management. And even though we might not necessarily take over medication, we'll give recommendations to primary care physicians, medications that are interacting and that may be causing some of that cognitive impairment. Okay. And then we have a neurologist that will sit through consensus, read over MRIs, and help us with our diagnosis. So we all come together with all these different results: blood tests, MRIs, neuropsych testing, neurological evaluation, and we come together and build the diagnosis. But we don't leave you at just giving you a diagnosis. We have so many resources, and if we don't have a resource, we know somebody in the community that has that resource. And, people say, oh, you're competing with them or that. We're not. We have to work together in Lubbock and these rural areas to bring our resources together to help everybody, because we can't do it alone. We just can't. So we need to utilize everyone and work together and collaborate.
Very good. And, it takes a village to raise a child.
It does.
It takes a village to be there for your parents when they're aging as well.
Absolutely.
Dr. Singer, thank you so much for being with us today. We certainly appreciate it. And we appreciate you and taking the time to watch. Hope you have learned something from this. Have a great one. And that's it for Real Talk with Teri.